Community healthcare workers are demanding permanent employment. They say while they provide a critical service, their work is not recognized. The health department says it's looking into the matter. eNCA's Nobesuthu Hejana spent time with a health worker in eNCA township in Cape Town.
Community healthcare workers are faced with a unique set of challenges as they go about performing a vital service. Khanyisa Bunyonyo's day starts with going to the Zolani Center in eNCA to fetch medication to distribute to patients who are no longer going to the hospitals because of COVID-19. Unfortunately, this morning, the medication was not delivered on time, so he goes to check up on his patients. Bunyonyo says as he and his colleagues have to deal with threats to their safety, they are marked for their smartphones, which they use for COVID-19 screenings, while women put themselves at risk going into houses of strangers.
People are getting robbed on our daily duties because we're just working. Even in the house, we are exposed to criminals. The females, community care workers are exposed to rapes because we don't know who is inside. We are exposed to COVID-19 as well. Sometimes we run out of PPEs.
Bunyonyo's next stop is a house where he was supposed to have delivered medication last week, but he wasn't able to because of a protest by his fellow community healthcare workers.
We need a permanent job to the Department of Health. They must recognize us.
The department says it's working on how best to absorb the workers.
There is also a task team at the National Department of Health, and we will provide input into that task team around exactly the same issue as to whether to employ the community healthcare workers.
The health department in the province says it will also look into the safety concerns raised by community healthcare workers. But for Khanyisa and others who need an urgent intervention, this might be too late. Nobesuthu Hejana, Cape Town.